what I think is really important to realize, and it's cool to just, be as an enthusiastic researcher as I am, is that we're now for the first time moving from diagnosis to treatment, which always means a huge shift in the diagnostic workup or clinical workflow, new studies, new criteria coming out. They already look at the new research criteria that I have, the ATN framework that has been updated, the ATN FVIS, a network or framework with different stages depending on the biomarkers that you use, etc. Because as treatment is coming, what is happening is that we're moving towards the necessity of a biological diagnosis. Because in the end, the biology is what you deal with, is what you affect. So I think a lot of questions that are coming once these drugs are available in Europe, and I'm talking about Europe because, of course, we know in States, one of them is already available. The other one most likely will come soon. I think a lot of lessons we need to investigate, how really at individual level, what kind of dose should someone get? How long should someone be on the dose? It will always be a combination of biomarkers and clinical impairments, 100%. The clinical view is absolutely key. Like, no diagnosis will just be made only on biomarkers, at least for the near future. That might change if we really go to primary prevention, but I think we're looking at a much longer timeline still. And another important line of work then will be to predict who has an increased risk of developing ARIA, the most common side effects of these current anti-amyloid drugs. So I think those are the big lines on research that really needs to go hand in hand with our clinicians and clinical experiences. And, once these drugs do get to the clinic. And then personally, if we make a final note, is bringing quantification to the clinic. So amyloid-PET is currently only done based on visual reads in the clinical routine. More advanced groups maybe are using the centiloid scale already to support their reads. But considering the current designs of these trials, centiloid quantification might become necessary to implement in clinical routine. And it's important that our clinicians familiarize themselves before it becomes, a requirement. So I think that's always good to get some training before you actually need to use it. And actually within that light, within the amyloid-PET consortium, we have developed a large document showing the robustness and the validity of this measure, of the centiloid measure, which has been submitted to the EMA, the European Medicine Agency, which actually has endorsed a positive biomarker qualification opinion recently, and is now available for public review. So if that goes through, then we have also a stamp of approval from EMA that this measure can be used clinically, which I think will be a huge step forward to bring quantification of amyloid PET to our clinical routine.